Hi, I am Dr. Ndamasole Homian, an oncologist at Trècheville. I'm presenting on the breast cancer epidemiology, treatment, outcome, and in correlation with NCCN Harmonized Guidelines for Sub-Saharan Africa in Côte d'Ivoire. This is a brief outline of my presentation. In introduction, we can say that breast cancer is the most common cancer in Côte d'Ivoire. Patients present with advanced stage disease due to patient and healthcare-related factors. Our purpose was to describe the presentation, treatment, and outcome of breast cancer in Côte d'Ivoire, including the concordance of treatment with NCCN Harmonized Guidelines for Sub-Saharan Africa. What was our methodology? This was a study among 30 women diagnosed in 2018 and with outcome review in 2021. Concordance with the NCCN Harmonized Guidelines defined as concordance in all aspects of treatment, and a reason for deviation were described based on our clinical experience. What were our results? Almost all patients were diagnosed at least 12 months after symptom onset. A third had a family history of breast cancer. Over 85% present with stage 3 or 4 disease. You can see the subtype distribution here. Most patients with early stage disease receive neoadjuvant chemotherapy, surgery, and post-surgery radiation when indicated. Almost everyone with advanced stage disease receive palliative care. All women with stage 2 disease were alive at follow-up. Over 40% of patients with stage 3 disease progressed, and 35.7% died. Of patients with de novo metastatic disease, over a quarter were alive after 2.5 years. Over half died, and the rest were lost to follow-up. Over half of patients with progress passed away due to the inability to afford treatment. While most treatment was evidence-based, it was concordant with NCCN guidelines in 10% of patients. Deviation were due to using chemotherapy that was evidence-based but not part of the guidelines. For example, FAKE instead of SA as neoadjuvant therapy. Other deviation were due to patients not able to afford paclitaxel every 3 weeks, so receiving it every 4 weeks. There was also a carboplatin shortage, so other regimens that were evidence-based but not part of the guidelines were used. Doxorubicin, cisplatin, is known to be active but has increased toxicity, so it's not part of the guideline. Some patients with metastatic disease had a mastectomy after a good response to chemotherapy, as done commonly in North America and Europe. In conclusion, we can say that all actors, including government and healthcare professionals, should engage in the work to improve early diagnosis and affordability and availability of treatment. The NCCN certified guidelines should include a robust discussion of a risk and the benefit of specific evidence-based chemotherapy over regimens commonly used in daily practice. Healthcare professionals in a multidisciplinary approach should develop local clinical guidelines relevant to daily practice. Thank you for your attention.